Welcome back for part 3 of Foley catheter insertion for the male client. So we're at the point now that we have cleaned up our supplies, but we're wanting to actually secure this to the right inner thigh. You want to make sure that you've got enough slack in this that it's not pulling on the meatus. So there are several ways to do that. The first thing I have here is a leg strap, and this is just one variation of many. You can end up wrapping this around the leg. This is actually a very large strap too. And it has Velcro closure on it. And you want the Velcro piece that's here for the actual catheter. You don't want to ever cover up the sampling port where you get a specimen, and you always leave the balloon port free. So I've secured it right here in between the two. That is one. The other way to secure the Foley is a stat lock. I'm not going to pull the adhesive off of this, but the adhesive pulls off the back of it. It sticks to the patient's inner thigh. Then you're going to place there's like two little inserts there, and you place it in there and you seal it down. That's a stat lock. Tape will always work if you have nothing else to use, okay? As always, remember not to cover up the sampling port. This is why I had the second piece of tape. So I've left the lumen for the inflating the balloon separate, and I've secured it right here underneath it, and I have not covered up the sampling port to collect a specimen. This way this is not pulling on the patient's meatus. You would want to make sure that the foreskin was pulled back over the end if necessary, and clean up all of your iodine. Now this Foley bag, the drainage bag, hangs on the immovable part of the bed. So you put it on the bed frame itself, or if there is a hook under there, sometimes there is, then that's what you would do. It always goes over on top of the leg, not under the leg. You want to try to keep anything from kinking it off and keeping it from patent. You want it to stay patent. So we've got it hanging down, and so let's talk about what we do next. We take our gloves off. We wash our hands, and let's talk about documentation. So what we document in the record is the type of catheter, the size of catheter, the amount of solution used for the balloon. We discuss the urine and what it looks like. We describe it. We talk about the approximate amount. Unless you're draining it to get an exact amount, then you would have to use a graduated measuring device. Whether you got a specimen or not, how the patient tolerated it, and then how you secured it, okay? So the actual documentation would look a little bit something like this. Number 12, Foley catheter inserted under sterile technique, balloon filled with 5 milliliters of sterile water, approximately 400 milliliters of clear yellow urine returned, no blood, no sediments noted, secured to right inner thigh with leg strap, tape, whatever you use to secure it. Patient tolerated well, and with all of our patients, we want to leave them safe, so we make sure that the bed is down in its lowest position, the call bell's in reach, and you have side rails up ×2. Thank you.